In today's podcast, my ongoing series to tell people, look, August 15th is going to be here sooner than you think, and that will be the deadline for applying for individual health insurance using the American Rescue Plan. COBRA, unemployment benefits, and more details. Time is running out. GH2Unfiltered.com is the sole location for Medicare ABCs, the 9-part video series. 9 parts. So, as I've said on this channel in the past, in every broadcast, I understand that the YouTube era kind of runs this show. That said, there are notable shortcomings, things that I've warned people about on this channel. What are they? Number 1, details are left out, right? In other words, I find it almost impossible to believe that you can get a full understanding of Medicare Part B in 5 minutes. In addition to that, number 2, and probably more importantly, is the fact that since you're on YouTube and you're getting, fragment of information from video channel 1, fragment over here from video channel 2, you get no cohesive message, no cohesive approach, no rationalized way of saying, okay, here are the risks that my household faces, here are my priorities that I have, therefore here's how we fit them together and create a selection. When you're getting fragments of information, you don't get this putting it all together, the cohesive, integrated approach. Medicare ABCs is there to do that. As I said, 9 videos, a segment for each one of the parts, an introduction, commonly made mistakes, full look at Medigap, Medicare Advantage, and also how to put out all the pieces together. For first-time subscribers to GH2 Unfiltered, you get a copy of Maximize Your Medicare, the paperback edition, which I will send to you anywhere in the lower 48 states without a shipping cost to you. In addition, you'll get access to Medicare ABCs, the Masterclass edition, as well as a ton of other videos full of information that I really can't release here in public. I have certain reasons for doing so. I'm highly regulated. I'm highly sensitive to the fact that people can pull a little piece of information out of context, use it wrongly. I would feel terrible, and I'd be wrongly to blame. So on both counts, there are reasons that I have a subscription-only channel. www.gh2unfiltered.com. Get your free copy of Maximize Your Medicare and access to Medicare ABCs, the Masterclass edition. In this segment, I discuss COBRA. So, generally speaking, COBRA is quite confusing. What happens is that if you work at an employer with at least 20 full-time employees and you get disqualified for health insurance under your group-sponsored plan, then you are eligible for COBRA. That said, the cost is going to be high because the employer is going to stop contributing, leaving you with 100% of the premium cost. So today's segment is about Bidencare, otherwise known as the American Rescue Plan, which has the payment for COBRA premium to be made by the employer through the end of September of this year. This is the result of what I've called Bidencare. You can see a lot of other posts, videos, broadcasts discussing Bidencare and how to get the best for your family. Let's just talk about back to COBRA. So like I said, COBRA, generally speaking, and let's just talk about the base case first, COBRA generally is very expensive because of the fact that the employer isn't any longer going to be contributing to your premium, leaving you with 100% of the sticker price, and it's going to be high. Under the American Rescue Plan, the employer is responsible to pay through the end of September. Now, don't get me wrong, for employers, if you represent the employer, you get a credit, a tax credit for your payments towards that. So it is not coming ultimately from the employer. It's coming from the government. It just so happens that's the path that I'm describing. Let me now talk about what you do if this is you. Oh, but first let me give you this one very important detail, which is that you cannot be accessing COBRA due to voluntary loss, meaning that if you retire or you quit your job, then you don't get this premium assistance. If that's you, then I'm recommending to persons almost across the board that they at least check out healthcare.gov and the American Rescue Plan, because the tax credits to individual health insurance can be up to 100% depending on your age, location, and household income. So, back to COBRA, and now let's just answer some questions and maybe even uncover issues that you may not have considered. The employer is going to pay through the end of September. The question is going to be what to do on October 1. So as a result of the fact that you have COBRA through the end of September, you can get to healthcare.gov, the marketplace in your state, and have the ending of COBRA on September 30th be the beginning of a special enrollment period where you can access individual health insurance, including the subsidy, to begin on October 1st. And that will last all the way through the end of 2022. There are proposals to make that permanent. The reason I suggest that is because then I've been asked the question of, hey, should I go to the exchange today? The answer to that generally is no. And the reason simply is because since the employer is paying 100% of the premium, therefore your health insurance is zero premium under your existing coverage. The real question is what happens if I have other circumstances which may make COBRA still the viable choice for the rest of 2021? Can this happen? The answer to that is yes. There can be a number of different reasons. Let's just go over a couple. First of all, let's just say that you have already met your household deductible and have made substantial progress towards your annual out-of-pocket maximum. That's an instance. Right, so there's not going to be a shortcut here. There usually is not shortcut. There usually are not shortcuts. You need to go through the math of money. Because your premium under COBRA is going to be high. Your premium under the Affordable Care Act is going to be low. That said, over here, what's going to happen is that your progress towards out-of-pocket maximum and deductible is going to be reset to zero. Can there be exceptions to that? Yes. Are they easy for you to locate as an everyday person? The answer to that is no. Right? Because there can be exceptional cases where under COBRA, even your progress towards the deductible and the out-of-pocket maximum can be brought to your new plan under the Affordable Care Act. That's possible. In the overwhelming number of cases, however, that is not possible. There is, again, no shortcut. There's a special group of people that I still need to discuss. And that's for persons who are using COBRA and waiting to go on to Medicare. So, you need to handle it very carefully. There's a reason that I've written a book about Medicare. There's a reason that there's a section in there about COBRA and Medicare. And that reason is Medicare doesn't allow you to have no health insurance for any period over 8 months. COBRA as your coverage doesn't count. Now, that doesn't mean, so in other words, you cannot have COBRA for the full 18 months under the idea that you thought you had health insurance and therefore not enroll in Part B. What you will find is if you did that, when you try to enroll in Part B, you'd have the late enrollment penalty, and then you would have to wait, and your coverage under Part B wouldn't start until the then following July. Those are somewhat being addressed under the Benefits Act, something that I've spent a fair amount of time in describing on Robert Powell's channel, thestreet.com. So in other words, what you're having here is this other interaction with Medicare. You'll want to be subtle. You'll want to be careful. You can reach out, leave comments, questions, or send me private emails. All of that information in the text below the video. At any rate, the bottom line here is the American Rescue Plan has provided notable, important relief for those persons on COBRA who have lost their health insurance as a result of involuntary reduction in hours or loss of your job, which has resulted in the loss of your group health insurance benefits. Deep in the weeds of the American Rescue Plan Act, otherwise known as a Bidencare according to my videos here on the channel, what you have is an additional detail, and now you can access even greater discounts to health insurance premiums. The way it works is that if you have received unemployment benefits at any time during 2021, you could possibly qualify. However, in order to do so, that's the point of the segment on how to access it. And you can see it here. Up on the screen is a press release from the CMS, which is the Center for Medicare and Medicaid Services, the agency that governs health insurance throughout the United States. You can see it here as part of the American Rescue Plan signed by President Biden. Again, lowering the cost of health insurance and opening more pathways for Americans. Starting July 1, which was just the other day, consumers who received or are approved to receive unemployment compensation for any week beginning in 2021 may be able to find even lower cost plans and save extra money on out-of-pocket expenses through healthcare.gov. And that's the key. This segment, the purpose for it, is that even if you've had health insurance and used the marketplace, that you've followed my other videos, whether you've reached out to GH2 Benefits and we've helped you enroll in individual health insurance using the marketplace, even then, these additional subsidies do not automatically kick in. You have to do something. For that, you can do it yourself by going on to healthcare.gov and reporting a life change. Okay? That's the way to do it. Easier way is make sure that it gets done correctly by simply reaching out to us. You can leave your comments, questions, or send us an email with a contact form up on gh2benefits.com. In either case, in any instance, the American Rescue Plan has even more benefits. Hopefully, those people who qualify are taking full advantage.